support provided so far. In particular, allow me to thank Ireland for the investment made over the years, education, adolescent girls, HIV, and particularly in Karamoja. We need your support to sustain these gains and keep the focus on HIV alive. I also want to thank the United States of America for funding almost 80% of the HIV response. Without your investment, we would not have made such important strides. But at this time of transition, Honorable Minister, where everybody is looking at their new partnership and cooperation framework with Uganda, perhaps it's time for a discussion on the long-term implication of financing as we proceed. So with that, I am going to invite Dr. Eddie Mukoyo, Chairman UAC, to please share with us the objectives and the welcome remarks. Thank you for your attention.
The Honorable Esther Mbayo, Minister in charge of the Presidency, the Executive Director, UNAIDS, Honorable Winnie Byanyima, the UN Resident Coordinator, Rosa Malango, His Excellency the Deputy Ambassador of Ireland, His Excellency Head of Mission, United States Embassy, Honorable Members of Parliament present, Uganda AIDS Commission Board members, representatives of AIDS development partners, representatives of implementing partners, scientists and clinicians, representatives of people living with HIV, representatives of religious and cultural leaders, representatives of civil society organizations present, representatives of the media fraternity, Uganda AIDS commissioners, management and staff, stakeholders participating from all corners of Uganda and beyond, ladies and gentlemen. On behalf of Uganda AIDS Commission, I'm greatly honored to welcome you all to the 13th Joint Annual AIDS Review 2020, which is virtual. You are all most welcome. Thank you for prioritizing this year amid your tight schedules during this period of COVID-19. This is a testimony of the importance you attach to the HIV response and ending AIDS as a public health threat in Uganda by 2030. The theme for 2020 JAR is ending AIDS, leaving no one behind. Uganda AIDS Commission annually conducts AIDS reviews to assess progress as well as fulfill reporting obligations, both nationally and internationally, as stipulated in the National Strategic Plan. The review also provides an opportunity to assess the country's contribution to the global efforts to end AIDS pandemic in line with the United Nations post-2015 agenda that commits to ending the AIDS epidemic by 2030. We will also look back at the trends of the last 5 years of the previous National Strategic Plan, 2015 up to 2020. The government of Uganda, AIDS development partners, UN agencies, and private sectors have invested heavily in the HIV response, and I would like to appreciate your enormous contributions, both financially and materially. It is therefore imperative that we inform the country of the successes registered, challenges faced in the implementation, and chart ways forward to improve on our future programming. Whereas Uganda has made tremendous progress in combating the HIV and AIDS epidemic through implementation of innovative public health strategies to address the HIV/AIDS epidemic, HIV remains and poses significant public health threat. Uganda has just ended implementing the last year of the National HIV/AIDS Strategic Plan 2015-16, which ends 2019-20, and has developed a new HIV Strategic Plan 2020 to 2025. This joint annual review report 2020. The fifth is to be prepared as part of the monitoring and evaluation mechanism for the National Strategic Plan 2015 16 to 2019 20. Will document progress made towards realization of the set targets over the last 5 years of implementation of the strategic plan. The government of Uganda has developed the fifth national HIV/AIDS strategic plan, which runs from 2020/21 to 2024/25, which will be launched tomorrow by the Right Honorable Prime Minister Dr. Lukakana Lugunda. The specific objectives of today's meeting include: 1, to review performance during the fifth and final year of the National Strategic Plan, provide the trend and demonstrate progress on the implementation of the National Strategic Plan based on the targets in the M&E framework, to review and provide highlights of the progress on the Presidential Fast Track Initiative on ending AIDS as a public health threat in Uganda by 2030. I thank the development partners for their enormous contribution towards HIV/AIDS response in Uganda, and I call upon them to continue with this spirit and join hands with the government of Uganda to fight the scourge which has become a public health threat to the country, which we are trying to end by 2030. I especially thank the Irish government for the financial support towards this event. I wish to thank His Excellency Yoweri Kaguta Museveni, the President of the Republic of Uganda, for his exemplary leadership and championing the fight against HIV/AIDS in Uganda. Distinguished participants, ladies and gentlemen, as I conclude, I urge all the participants for active participation and provide valuable contributions and recommendations to inform our undertakings and input to the HIV/AIDS programming for the next national HIV/AIDS strategic plan. I wish all of you fruitful deliberations and discussions for God and my country.
Thank you very much for that. Honorable Minister, it is my distinguished pleasure to recognize that we now have the UNAIDS Executive Director online. So she has joined us online at the right time. To the next presenters coming in, I will encourage you to start with all protocols observed, to be able to jump from there. And then once again, to our audience, please follow us on NTV, UBC, as well as social media. It is a great pleasure to now invite Dr. Nelson Soba, Director General UAC, to present the GAR report. Thank you.
Thank you very much, Your Excellency. Our chief guest, all protocol observed. I'm going to use the next few minutes to share with you highlights of performance for the last 1 year, but also doing comparisons for the other 4 years, given as Her Excellency shared that we are coming to the end of the strategic planning period and strategic implementation period, and therefore looking at results, not just for 1 year, but for the rest of the period, so that we are able to compare on what we are, on where we are, and it gives us opportunity to, even as we launch into the new strategic plan, to see where we've started from and how we are going to move forward. Okay. That's the outline of my presentation. I'll be fairly fast because later on we should be able to look through the detailed report. The PowerPoints have been shared and we can be able to follow. Our chief guest, one of the key targets we set during the 5-year period was the UNAIDS 90-90-90. And that is 90% of the people who are living with HIV testing and knowing their status, And the second 90 is 90% of those who are positive getting enrolled on treatment. And the third 90 is 90% of those who have been enrolled to adhere to their treatment so that you achieve viral suppression. So by the end, if you look, we are comparing especially the immediate 3 years preceding where we are now. And the color codes are helping us do that for the 390s. And when you do the comparison, we had done pretty well. As you can see, by December 2019, which is the color blue, we had achieved the first 90. But as we speak now, we've dropped to less than 90%. We're at 89 percentage point in terms of people who testing and knowing their status. The second 90, which is when you compare it with people who are living with HIV, so 90 of 90% is what gives you 81. And we are, if you look at where we are now, we are at 84 of that. So we are above the target in terms of the second 90. And the third 90, we are at 75, which is also above the target, because 90% of the 81 whom we will have enrolled should give us 73, but we are at 75 of that. So not doing so well on the first 90, pretty well on the second and third, but at the end of December, we should have the final results for us to be able to tell how COVID has impacted. I have, at some point later on, I'll share with you the impact of COVID and some of the aspects that it has been able to affect. Overall, in terms of the AIDS-related deaths, it's the eligibility of the font is quite small, so you may not be able to see. But we've significantly brought down the deaths related to AIDS, as you can see, and we attribute that to the massive enrollment of our clients on ART. From, if you look in the early 2000s, the AIDS-related deaths were hovering in the period above 80,000 deaths per year. And as we speak now, as you can see from that curve, we are about 20,000. In the number of new infections, that has also come down, as you said earlier on. It is not come down as sharp as we would have desired, because the set target was about 75%. That's what we wanted to achieve by 2020, but we've fallen short of that. The number of people living with HIV has increased slightly now. That's because the HIV positive people are being put on treatment and they are alive and living, and we still have not completely closed the tap. That's why you see that curve going slightly up. So when we go to prevention, those are some of the results that have been have contributed to what we've seen before. Over 2 million people being reached with communication, gender-based violence, and sexual and reproductive health interventions. We have achieved a 62% reduction in new HIV infections, over the 5-year period, especially for amongst the young people. The achievement was 34%. We've had a tremendous achievement in the area of prevention of mother-to-child coverage at 95%. And 84% as we speak now of pregnant women were tested for syphilis, because when we assessed for that indicator, it's not just looking at the HIV, the babies who are HIV negative, born of HIV positive mothers, but we're also looking at their positivity for syphilis, given its contributory factor. Because we've had challenges with men, we've looked at that indicator, and the male partner testing has increased from 26% in 2016 to now 38%. Not a marked increment, but given that this is one of the areas that the Presidential Fast Track Initiative focused on, that result we would like to build on it, and there are very specific interventions that have been built in the new strategic plan. We've mapped and estimated the size of the key populations, and also we've been able to reach 3 million men with safe male medical circumcision during the implementation period. Condom use is one of the key interventions in prevention. And although we've not performed as well as we would have loved, when you look at the two graphs, we've had over the last 5-year period, we've had an average of 200 million condoms being distributed every year. That's probably around half of what would be required. So if you look into the NSP, we've projected that we should have about 500 million per year. The thing about condoms is that the female condom uptake has been lower, has been suboptimal, and that is an area that we need to do more work. And even as we continue to promote the male condoms. A total market approach is what has been designed and being used, working again with the Ministry of Health and partners. HIV testing, which is our gateway to prevention and care and treatment services, we've had some new innovations. So while the total numbers tested for 2019 and 2020 may look lower than the previous years, it's because we've adopted very specific testing methodologies, that are targeted, and we've had a higher yield of, the HIV positive clients for that, and then have them linked to ensure that a higher percentage is linked to care for those who test HIV positive. And some of the highlights of the prevention interventions that have been done include 95% of women attending antenatal at least once, 84% of women being tested for syphilis. I've already talked about the male testing, the achievements in new infections. And one of our key areas of focus is the adolescent girls and young women. When we did the investment case modeling, we saw that if we invested in that category of population, we would have a maximum reduction in new HIV infection. So again, over the implementation period, through a program called DREAMS, we've reached more than 400,000 young girls and women in 15 districts. And the Global Fund has also supported similar interventions, working with the Ministry of Education and the Ministry of Gender in more than 39 districts. In care and treatment, we've had, if you look at the broad results, we've continued to enroll for the entire period. We enrolled more than 800,000 people, close to 1 million on ART. The Ministry of Health designed a client-friendly and focused approach called the differentiated service delivery model that focuses on the client, tries to deliver quality services while reducing workload for the clinician at the health facility. This is where, for stable patients, they can be provided with multi-month dispensation of between 3 to 6 months of what they require, and they only come to the health facility when they need to. That way there's decongesting the health facilities, and this is one of the models that is being promoted, and it's picking up slowly within the communities. Of course, there are issues around stigma that are still being addressed through innovations. There has been an extensive lab network across the country with more than 100 hubs that help connect to the central public health laboratory. And that has led to a number of results in way of impact that are outlined in there. I already spoke about the HIV-related mortality and morbidity that has been reduced. Again, that slide continues to share what we've been able to achieve in the area of coverage of antiretroviral therapy and viral suppression for the second and third 90. So again, we can look at the hard copies of our PowerPoints that we have for us to be able to see the details of that. I'll not go into every detail. But there have been very specific systems-related factors that have contributed to these results that we see. We've made investments in the district health information system, the electronic patient monitoring records, the dashboards, the people are able to report every week. For instance, we get reports through the Central Public Health Laboratory displaying what is happening and reporting on several indicators from the different local governments around the country. And that has enabled the teams to tailor the interventions and look for either those who have been lost to follow up. The supply chain has also been strengthened. We've had a continuous quality improvement approach institutionalized, and the area of human resource continues to be strengthened. Of course, we know that with COVID, there are now greater challenges because we have divided attention given the challenges that it brings. But similar investments have been made in the area of monitoring, planning, and also implementation, not forgetting the guidelines that have been put in place and the engagement of the leadership, especially through the Presidential Farak Initiative. The issues around care and treatment is ensuring that we continue to focus, especially on children, on adolescents, on men, and the key populations, who tend to be left out, because again, either it is stigma for children because they can't speak, and the key populations because of the legal issues around, some of the categories. We specifically need to look out for these populations to ensure that interventions can reach everyone for us to be able to continue to have if we are to continue to have a dent on new HIV infections. There are still gaps within the systems that we need to plug. I've spoken about some of them. But we are also seeing issues emerging. For instance, those who are aging with HIV, they have comorbidities, including the non-communicable diseases, which need to be attended to. There are also efforts to strengthen toxicity monitoring, which have been reported. Good enough, these have been followed through and studies done, and especially on some of the new regimens and prophylactic regimens, and interventions have been put in place. And not forget that at this particular time as we speak, COVID-19, while it is important to address it, could also, unless we keep our eyes on some of these interventions, it could reverse some of the gains that have been made. This slide tries to summarize some of the quick assessments that have been done around the effects of COVID-19. And of importance for us to note very quickly is that there has been noticed a reduced utilization of HIV testing services in the community and also the health facilities. Also, the initiation and antiretroviral therapy declined by 31% in the period April to June alone, just that quarter, which could be an indicator of what is going to happen during this period, and therefore looking for ways to ensure that these gaps are plugged. And when you look at the period between December 2019 to now, we know that the ART coverage is not where it is supposed to be. There has been a reduction. So there are a number of findings that have been picked that should help us maintain our focus and energy. One of the challenges that picture shows private sector engagement, where food and was being distributed. There is Dr. Karusa in the background there. I think it was a donation from UNAIDS, but at that same event, the private sector had distributed sanitation materials to the National Forum of People Living with HIV, which was subsequently distributed countrywide. Those are the outcomes under social support and protection. I will not go through every single one of them, but just to highlight that all stakeholders have been important in trying to address the gaps. Stigma and discrimination is one area that continues to pose a challenge, but over the implementation period, we registered a reduction from 50 to 24% in self-stigma, and that is significant. And this was an assessment done by the National Forum of People Living with HIV. We've continued to work with cultural and religious leaders in fighting stigma. In this picture, the Archbishop of Uganda is seen signing off a commitment at Candlelight Memorial commemoration in May this year. Also, there has been support to reach out to the orphans and vulnerable children, and some of the numbers here represent the interventions that have been done, whether to the, through the youth livelihood programs, through programs targeting the elderly persons, that has also been increasing, women empowerment, but also economic strengthening. So those numbers may not be exhaustive, but they represent some of what has been able to be done in the past. So in this area of social support, some of the effects that we think the COVID-19 has impacted on included, suspending community programs of apprenticeship, livelihood, some of the safe spaces, and this only made the groups more vulnerable, and also worsening the vulnerability at household level. There has also been lots of reports around the gender-based violence, which has increased because a number of factors. But there have also been interventions to address some of this, and those are what we see, including the distribution of the hygiene kits that I spoke about earlier, the food distribution, both through government, but also the other non-government agencies. Lastly, as I come towards the end, I'll touch on some of the aspects related to system strengthening. And that's the thematic goal and the 6 objectives under the system strengthening component. And I'll not again touch every single one of them. But under the pillar of governance and human resources, like I spoke earlier, the presidential fast track really injected new energy and effort when we went around the country mobilizing the different constituencies, and we've started to see results as a consequence of that intervention. The US leadership has been re-energized. Chief guest yourself, you've been able to support and show leadership at every single event that we've called you. You haven't disappointed. And we've also tried to strengthen the multi-sector coordination through technical working groups. There's more work to do at the sub-national structures to ensure that the coordination committees at the districts, in the municipal councils, at the sub-county, and at parish level should be made to function. This, although in some of the regions they are functional, but they are not where we would like to be. There are gaps around the human resource, although there were improvements, but there is work that still needs to be done. We saw staffing levels improving from 64% to 78. The target was 80, but we've not reached that target. But we also got support from the US government for a number of human resources that government needs to take up, and therefore we need to work on the transition plan on how that can be addressed. In the area of medicines and services, again, like you spoke earlier on, there are issues of financing. A lot of the financing remains from the donors. We've had the contribution from government, and we've also supported strengthening of storage through warehouse construction. Quantification has been institutionalized. The ordering systems and logistics are all in place now. And if there is, and also for especially the last 2 years, including the current year, we've had sufficient funding for the commodities. The challenge may be how to ensure that the beneficiaries can access those commodities. I've also spoken about the other services earlier on, so I will not repeat them. The issue of ART rollout has been consolidated. The implementing partners have reorganized, and there has been rationalization, so they are much fewer than they used to be, and offering almost the same service depending on need for the different regions, unlike previously, when the services were not necessarily equal. And there has been a lot of additional support staff to support monitoring and implementation. The effect monitoring and evaluation, the COVID-19 effect around this has been delayed reporting, client mobility to refill ARVs to those sites, and then, but tools are being developed to ensure that documentation can be improved. There are also results around the area of strategic information that I'll not necessarily go through every single one of them. As I come towards the end, I have 2 more slides to go. We've had some key challenges. I've spoken about some of them. A number of structures for coordination remain not fully functional at the lower level. And we've put interventions into the new strategic plan. The question of heavy reliance on donors, Your Excellency, you spoke about it, the issue of the research agenda, and we've made a number of recommendations in relation to those challenges that have been highlighted. That slide just demonstrates the resources that were available and by source, but we are in advanced stages of conducting a national aid spending assessment, and we will have actual results by December that shows us who contributed what and where did it go and what did it work on. Chair, this slide is projections that had been made for the 5-year period that totaled $3 billion US. And again, this study is what will give us what was actually realized and what was the gap. I thank you for listening to me.
Thank you very much for that presentation. I am now delighted to invite the Deputy Ambassador, Republic of Ireland, to speak to us, and I understand she's connecting online. Technical team, are you ready, or do I need to do something else?
Good. Good morning. Good morning. Thank you, Rosa. I have now been unmuted.
We can't hear on the speakers. Nicole, hold on 1 second. Can you connect her so that everybody can hear her, please?
Can I be heard? Great. Lovely. Thank you. Good morning, everybody. Thank you so much for the welcome. It's genuinely a privilege to be participating today, all protocols observed. I would, though, like to start by saying to the people of Uganda that the people of Ireland stand in solidarity with you at this unprecedented time, a time when this global pandemic has had a huge impact on all of our lives. I think it's important to say that the COVID-19 impact on Uganda has been significant, and we all need to continue to work tirelessly to prevent the spread of the virus. However, we are here today as AIDS and HIV partners and advocates to ensure and signal the importance of continuing to work to prevent further HIV infection. It is now more important than ever, when the vulnerable are more vulnerable, not to take our eyes off HIV prevention and treatment, and to continue to strengthen and resource health systems. I'd like to congratulate all of those who played an important role in organising today's key event, the 13th Annual Joint AIDS Review Meeting. I'd particularly like to thank the Government of Uganda, the Uganda AIDS Commission, UNAIDS, development partners, and all stakeholders. Ireland has been proud to fund this meeting and many meetings over the years in order to support all efforts around HIV prevention and coordination in our response. Looking back and making sure we look forward into the future with evidence. Now more than ever, it's important to take action on the basis of evidence and learn from best practice as the challenges that face us loom ever larger. As the UN Resident Coordinator Rosa pointed out, and the Director General of the UNAIDS Commission, this year's annual Joint AIDS Review meeting is very significant, as it not only looks at the 1 year, but it looks back on the last 5 years, this being the 5th year of implementation of the strategy. This meeting also signals the launch of the development of the next 5-year strategic plan. And Ireland is very proud to have been able to allocate resources to the development of this plan also. The Irish government and the Irish people have prioritised a focus on HIV and AIDS, both globally and in Uganda, for the last 2 decades. We have tirelessly advocated for the need to continue an emphasis on prevention, to help reduce stigma and to support those living with HIV and AIDS. We recognise the importance of bolstering health systems through increased investment and enhanced resources for human resources. Through our focus in Karamoja over the years, and in partnership with the UN family, we've been privileged to support countless communities in the fight against HIV and AIDS. I appreciate the leadership of the government of Uganda and all the partners for your efforts that have enabled Uganda to register substantial gains, as highlighted by Dr. Musoba, including reduction in the number of new HIV infections and prevalence, and solid progress in reaching the 90-90-90 targets. However, with targets still to be achieved, there is no room for complacency. We have come so far. Let us continue to make our actions count. This is a very short speech, so I would just like to wind up by making 4 key short points. In these unprecedented times, we need to work hard and collectively to ensure continuity of services. We must guarantee that strategies and policies going forward promote the integration of HIV, AIDS, and COVID-19 interventions to ensure maximum efficiency, particularly when there are competing priorities in relation to health financing. Secondly, it is the responsibility of all of us to ensure that the gains made in health and HIV are not eroded by COVID-19. Advocating for continued financial resources for HIV prevention and treatment, as mentioned by a number of speakers already, is of the utmost importance. Thirdly, we need to work in the short, medium, and long term to strengthen health systems so that they become resilient and effective even in times of crisis. Critical is a continued focus on strengthening community health systems to support HIV prevention and primary prevention of all major diseases. Finally, if there is a time that we need to work better together, it is now. Better coordination around our responses will make them stronger. We need to continue empowering young people as champions as we look to the future, their future. Not a moment more can be lost. So, thank you once again for allowing me the opportunity to address this very important meeting. I look forward to all the discussions and deliberations throughout the 2 days. And I will hand over now to the next speaker. Thank you. I wish you well.
Thank you very much. Okay, it's back now. Treasurer d'Affaires, Embassy of the United States of America to the Republic of Uganda.
Meeting. 2021. I commend the organizers for embracing innovation and allowing virtual participation today. Always comes with a couple of technical glitches, but it's hopefully will continue to work well. I think, as you all know, the United States has for years worked hand in hand with Uganda to improve the well-being of its citizens through programs in economic development, security, education, but especially health. Annually, our support to the people of Uganda totals more than $970 million, and more than half of this assistance, approximately $500 million annually, is dedicated to programs to improving the health of the Ugandan people, the bulk of which goes to supporting HIV programs through PEPFAR. Through the collective work of our U.S. government agencies, the Departments of State and Defense, USAID, the Peace Corps, the National Institutes of Health, and the U.S. Centers for Disease Control and Prevention, or CDC, the United States aims to support Uganda in reaching epidemic control while providing health and treatment to Ugandans living with the disease. Our programs focus on HIV prevention through elimination of mother-to-child transmission, voluntary medical male circumcision, provision of school-based HIV and violence prevention programs for adolescent girls and young women, provision of pre-exposure prophylaxis to special populations, and implementation of care and treatment services, including managing TB co-infection. The United States also provides on-site technical assistance, laboratory strengthening, information systems, monitoring and evaluation, public health research, surveillance, and surveys, such as the ongoing Uganda Population-Based HIV Impact Survey, or UFIA. Together, we've made great progress towards HIV epidemic control in Uganda and across Africa through the continual use of data to inform strategic program implementation. Because we find important regional differences and key gaps across the 95-95-95 cascade here in Uganda, especially for men, adolescent girls and young women, and children, the United States continues to partner with the Ministry of Health to implement a robust, targeted, systematic, and client-centered approach to HIV prevention and treatment to close these gaps and to accelerate achievement of HIV epidemic control. With guidance from and collaboration with the Ministry of Health, we've embarked on aggressive HIV case finding and enhanced retention efforts to improve adherence to treatment, including introduction of better treatment regimens to achieve virologic suppression. Through this ambitious and highly successful effort, as was pointed out earlier, we've achieved an estimated 89% of the 1.44 million people living with HIV in Uganda having been diagnosed. 84% of those have been initiated and retained on treatment, with community viral load coverage somewhere in the mid 70% range. Together, we've also made positive strides towards detecting and treating missing cases of tuberculosis. As you may recall, we embarked in 2019 on an ambitious 100-day nationwide effort championed by the Ministry of Health to enroll 300,000 people living with HIV on tuberculosis preventive therapy to address related comorbidities. In short, together we've made and continue to make great progress, and there's much to be proud of. But now we face a new hurdle. The COVID-19 pandemic has made HIV work more complicated. We must continue to innovate, to evaluate, and to adapt in order to end HIV in Uganda. To this end, we continue to develop innovative ways to deliver quality services. Our U.S. government staff continue to provide technical assistance and human resource support, albeit often remotely, as current circumstances dictate. One such approach is the implementation of virtual HIV services delivery across PEPFAR sites. The United States, through the Health Resources and Service Administration and JPIGO Uganda, is also supporting the Ministry of Health through the ECHO telementoring platform that aims to improve the quality of HIV care through virtual platforms in real time. Our partners are delivering drugs to HIV clients through differentiated service models to ensure that they stay on treatment, especially during the COVID-19 pandemic. Our fellows under the public health program continue to conduct invaluable programmatic studies to understand how HIV and TB programs are performing to ensure that our current response efforts are working. This year is a critical benchmark for Uganda and the global community. Conversations such as today's Joint AIDS Review will determine whether Uganda will achieve the threshold, the cascading threshold of 90-90-90 or 95-95-95 to be more ambitious, of HIV epidemic control, which of course is a key milestone towards eliminating HIV, with the hope that we can achieve this year in 2020. It's critical for us to sustain our gains despite challenges as we race to the finish line. In closing, I'd like to thank the Office of the Prime Minister, the Uganda AIDS Commission, UNAIDS, other development partners, and the people of Uganda for the unwavering commitment towards an AIDS-free generation. A healthy Uganda is ultimately a more stable and more prosperous Uganda. And as we reconvene tomorrow for the 11th Partnership Forum, I hope it can propel us further, stronger, together. Thank you very much.
I thank you very much for the statement. Now, before we begin the keynote address, allow me to highlight, Honorable Minister and distinguished participants, a bit of data. Honorable Minister, the African Union recognizes the importance of HIV/AIDS as they go forward in order to achieve the Africa we want. According to the World Health Organization, Are we okay? According to the World Health Organization, 5,500 AIDS deaths occur a day on the African continent. HIV/AIDS and malaria remain the leading causes of death in Africa. And now we must add to that the COVID-19 pandemic. So as we go forward, we must invest in ensuring we have the appropriate capacity to respond concurrently to COVID-19, HIV/AIDS, malaria, non-communicable diseases, and other priorities. Honorable Minister, distinguished guests, the UN Secretary General has said, the progress towards ending the HIV epidemic would not have been possible without forceful advocacy, solidarity, and a spirit of shared responsibility. We must maintain this spirit, end of quote. It is with these words that I now have the distinguished honor to invite Her Excellency Winnie Byanyima, Executive Director of UNAIDS, to give the keynote address to this gathering, the 13th Annual Joint AIDS Review and 11th Partnership Forum virtual meeting. hope the technical issues have been addressed. Your UNH.
So get moving with Movit. You'll definitely stand out. Movit. All day confidence.
Together, Turinawe.
Co-sleeping essentially means sleeping in close proximity to your child. So it could either be in the same bed or in the same room. Now there's different kinds of co-sleeping, apart from the one that we are all familiar with, which is sleeping in the same bed as your child. The other is the sidecar arrangement, so having your baby's crib placed next to your bed. And like I mentioned, sleeping in different beds but in the same room. And then also inviting your children in or letting them know that it's okay for them to come into your bed as and when it's needed. So question, ladies, should you co-sleep? And I guess the bigger question, for how long? I see guilty people.
I see Pumla, they slept in different houses.
I'll be honest, I've never slept in the same bed as, I didn't, when my child came from hospital, because even in the hospital, he was in his own bed. When he came home, sidecar arrangement, as you said, I slept in my bed, baby in his cot the whole time, and he moved out of my room when he was 3 months old. He slept in his own room. He has slept in his own room from the age of 3 months. And for me, I don't know, at that time, it had nothing to do with what's advantageous for the child or me? I just needed to sleep.
Yeah, I think I was a lot like you, Pumla. I needed to sleep, and then I also needed to wake up to be able to breastfeed, because one. But never woke up anyway.
You didn't wake up? You did not wake up?
I didn't achieve my goal. I don't. Brian would wake up and then bring the baby and say, Mukwan,
Wake up.
the baby here. But then now I would have to I had to get up and then feed. I didn't have the luxury of throwing the boob, because once when I did, I woke up with a boob in face, in milk, as in, don't judge me, don't judge. I'm just being honest.
How many times have you heard of a baby getting getting suffocated with a mom's boob?
I've had it before, not someone particular that I know of, but I've had stories about it.
Anyway, do you see, like they say, you're half asleep?
Yeah.
A mom doesn't roll on their baby. They think they will.
Yeah, I think so.
But no matter how, even a father, no matter how blazed will come home, still, we would never, you're always in the back of your mind, there's this precious little.
And be proud of having led and fought this disease. We were a model country pursuing a multi-sectoral approach, engaging everybody from political leaders, to cultural leaders, to religious leaders. I remember as a mobilizer of NRM, we were instructed not ever to conclude a speech without passing a message to whoever we are talking about with our own prevention. Today, it is still a high priority in our country. You, my friends, you've worked hard and your efforts have paid off, as we were seeing in those results. We are not 100% there, but they are impressive results. We are one of 14 countries in the world who have achieved that 1990 target of 73% of viral load suppression. I think you said it was 74 among people living with HIV. Clearly not where we want to be, but we are among the leaders. So we must celebrate this success, but also go further to defeat HIV for good. For example, in Uganda, I understand, as you have heard, our funding, we are only 10% investing our own resources. 90% we depend on our friends abroad. That makes our response vulnerable. We must move faster, find pathways to self-financing. So we should be working hard to implement the National Health Insurance Scheme and also critique it and see that it actually is a package that will deliver to people living with HIV and also prevent new infections of HIV. So the package must work for our struggle. At the global level, progress on the AIDS response has also been made, but we also see we are still leaving many behind. 38 million people today live with HIV. Of these, 25.4 million are now on treatment. That means there's 12.6 million still waiting, so we have a journey to go. New infections have been reduced globally by 23% since 2010, but then HIV infections are actually increasing in some regions. They are coming down in our region, and Uganda is part of the success of our region. but in other regions we are seeing increases. It's moving in the wrong direction. And tragically, everywhere in the world, we are failing children. Children are still much less likely than adults to access HIV treatment and to stay on it. That's a failure. And now, of course, COVID-19, as we have heard, of course, it has changed our world and is setting us back, as we've heard from the Ugandan report. And the latest UN report tells us that this pandemic, unless we do things very, very differently, is reversing decades of progress on fighting poverty, on achieving healthcare for all, education for all, on all the SDGs. Our progress towards ending AIDS as a public health threat by 2030 was already off track before COVID. Let's admit that. But now with COVID, we are going to be blown further, of course, unless we do things differently. COVID has highlighted our interdependence, but also magnified or put a torch and exacerbated the inequalities that exist within our countries, between our countries. I will talk about gender inequality because that's really important in the HIV context in our country and in sub-Saharan Africa. It's driven by the high levels of violence against women and girls, the discrimination against women and girls in society. All this driven by our own social norms that we can change. And when we change, and also driven by gender blind policies that don't tackle these social norms that drive the higher vulnerability of women and girls. It is a shame that in many countries, girls and young women are 5 times more vulnerable to HIV than boys and men of the same age. HIV has always been an epidemic of inequalities. It is really unacceptable that we still have, that last year we counted 1.7 million new HIV infections globally when we have the tools, the scientific tools for prevention. And most of these infections are here in Africa, okay? Every week, 5,100 young women and girls in sub-Saharan Africa are infected with HIV. Every week, 5,100. These are our daughters. These are our children. So some of this we have to understand is not some of it, all of it is really driven by inequalities in society. If we make progress to close these inequalities, we have the tools for prevention, for treatment and care that could give everyone a good and long life. Decades of experience in responding to HIV are today being used to respond to COVID-19. That is something we should be proud of. In fact, we observe that in many countries with the high burden of HIV, our responses are in fact stronger many times than responses elsewhere because they are built on what we've learned in fighting another epidemic. But, and indeed, we must fight hard to make sure that the world doesn't repeat the same mistakes that we made in the early struggles to fight HIV. That's why UNAIDS is leading a call for a COVID vaccine to be what we call a people's vaccine, available to everyone, everywhere, free of charge at the point of use. This is important because we saw it with HIV, that when ARVs were found, that it took another 5-6 years and millions of our own people dying as we waited for the price to come down for our people. We can't make that mistake this time. We must all get the vaccine. We must share it so that all of us in the whole world recover from this pandemic. So it's not just about not repeating the old mistakes, it's also about resetting, pressing the reset button and having a new normal, because normal was the problem. It wasn't the good place to be. We want healthcare for all. We want a world that values everyone, that leaves no one behind, as we say in the SDG agenda. I want to highlight 3 priorities and then close. One is what you've talked about, and I think you heard the message from Ambassador McHugh. I agree with her. Healthcare is a human right. It should never depend on how much money one has in their pocket. So governments should provide publicly funded health care that is truly for all without discrimination. And then the question always is, where will government get the money? Well, we've done many calculations. We know that if all the money that could be taxed from the rich was coming into the coffers of government, we would have resources to pay for healthcare, for education for all. But we must start by reforming the global tax system, because too much of production that is done in our countries is the profits are shifted away and placed elsewhere where it does not come back to benefit us. There are a lot of loopholes in the global tax system that needs to be plugged so that we can raise our revenue. So we are calling for a global corporate tax reform that could help developing countries to tax the production in their own borders, the business in their own borders. We estimate that developing countries lose more than 100 billion every year, $100 billion every year through the tax dodging that is allowed. It's actually official because it's within tax rules of today. If we don't change them, we can't raise that money. So that's an issue about how to raise the money. But it's also about how to make every dollar stretching it and making sure that every shilling we have is going towards its development objective. So it's also about our own health resources being spent well, not being diverted, and also being spent cost effectively. On that, UNAIDS, we are going to build our capacity and we're going to support you to make sure that these HIV precious resources are spent on the right things and deliver the maximum results. That's something we are building in our new strategy, supporting on health financing through these ways. Of course, I also wanted to mention debt. Our countries, this epidemic, pandemic, finding us in a situation where our debt levels, our indebtedness was growing across Africa. Actually, Uganda, we are badly off, but not the worst case. There are many countries that had reached their debt ceiling and had reached levels of debt distress, or were almost at debt distress, more than half the sub-Saharan African countries. So today, to have a situation where debt repayment is higher than the total health budget, I think is scandalous. In some countries, it is like that. So we need debt relief that goes further than has been obtained. We also need debt cancellation, but we also need better ways of development financing. So that's going to be a big issue of today: debt, 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 and how to deal with it to give us the breathing space to fight 2 epidemics. Well, so that is what I want to say about health financing. A big part of it is in a global corporate tax reform to give us the fiscal space. It's about debt and how we are relieved of debt in order to have the resources we need to survive. But it's also about efficient use of the resources we have. Coming to the second message I had is about communities and human rights at the center. We know from our experience that unless we put human rights at the center of fighting an epidemic, you're not getting anywhere. So it's not just about investing more money in the response. It is also about, it's not about fiscal space, it's about human rights space as well. When communities can participate in decision making, in service delivery, if they can be able to protect the human rights of everybody, our HIV outcomes are always improved. We know that. But where stigma, discrimination, criminalization shut out citizens, whole communities, HIV responses struggle. They don't get the results they need. So that's why we said in the AIDS response globally that we must commit 6% of all HIV investments to community-led action and to social enablers, and to ensure that 30% of all community-led, led by the people themselves. I was very happy to hear Ambassador McHugh mention strengthening community health systems. We have to do that. And that means community health system, that means all communities without discrimination, including those who are criminal in the law book. They need their health too. They must lead their services too and be part of healthcare for all. Now, more than ever, it's time to step up on those commitments. We must step up in that area of human rights. The third point I wanted to make is about connecting education and health, because we know, for example, that if girls could stay in school for a full round of education up to secondary school level, finish secondary school, their vulnerability to HIV is reduced, guess by how much? 50%. Just to open the classroom door for girls and they stay in school, you will reduce their vulnerability by a half. Now, if you also add in the school space, take out violence, sexual violence in the school space, give comprehensive sexuality education so they understand their bodies and their sexuality and their choices, fight toxic masculinities, help boys to see themselves as strong without being sexually violent. So if you add all these in the school space, you reduce girls' vulnerability even further. So I'm excited to lead an initiative between UN Women, UNFPA, UNESCO, UNICEF, and us at UNAIDS to persuade and encourage and support those governments that want to roll out secondary education and also put in the school space these other layers of initiatives that empower a girl, that take out violence, to support them to get to that goal of universal secondary education that reduces girls' vulnerability to HIV. I'll tell you more about this as we go along, but it's a new and exciting initiative. So let us keep our gains. Let's fight hard in the context of COVID to maintain the gains of HIV. This means indeed sharing what the HIV movement has built through infrastructure and resources with the fight on COVID, but in smart ways that don't take away, shut off services that are for HIV. It's painful when people who fought with their lives start losing what they fought for because there's another epidemic. We must make what we have work for both. And you know best how to do this. You can innovate. So I want to end there by saying how proud I am to be a part of you and how I hope you will also support me in my global role to fight AIDS and end it by 2030 as a public health threat. Thank you all for listening to me, even though I can't listen to you. So sorry. Thank you all.
It is now my privilege and an honor to invite the Honorable Minister Esther Mbayo, Minister for the Presidency, to give her remarks and by doing so officially open this review. Thank you, Honorable Minister.
The Honorable Namboze, the Chair of HIV/AIDS Committee of Parliament. Before I proceed, allow me to, for matters of clarity, to remove the mask since I'm protected by my neighbors. The Honorable Nambozi, the Chair of HIV/AIDS Committee of Parliament, the Executive Director, UNAIDS, the Honorable Winnie Byanyima, who has joined us on Zoom, and other development partners who have joined us on Zoom, the UN Resident Coordinator, my sister Rosa Marango, His Excellency, the Head of Mission of the United States Embassy, all participants, I want to welcome you all to this conference. I once again warmly welcome you to this 13th Annual Joint AIDS Review Meeting and the 11th Partnership Forum. It is the first ever virtual conference in the history of our national response. I congratulate you all for the contribution made of all manner, not only to enable this meeting happen, but most importantly, towards the fight against the AIDS epidemic. The occurrence of AIDS and COVID-19 pandemic at the same time could be of devastating impact. Indeed, Uganda is facing an unprecedented test of her resilience. We have already seen that COVID-19 pandemic has impacted livelihoods and access to HIV services of people living with HIV. But as government, we have moved quickly and addressed that problem earlier on. In the early stages of the COVID-19 pandemic, Uganda implemented travel restrictions consistent with the principles of social distancing aimed at avoiding crowding in public transport, transportation of the virus into the country, and amplification of transmission from one part of the country to the other. However, there were exceptions to the travel ban, which include travel abroad for medical evacuation, the United Nations operations, ambulance services, and accessing health, all HIV services that were considered as part of the essential services. The high-level commitment of ending the HIV/AIDS epidemic exhibited in the various years has resulted in reduction in the new HIV infections, drastic fall in the mother-to-child HIV transmission, reduction of HIV-related deaths, and others. However, the burden of HIV epidemic in Uganda remains unacceptably high, and our commitment and efforts must not wane. Today, we have come together again to review where we are in Uganda's HIV response and where we would like to go and how to get there. A new National Strategic Plan 2015-2016 to 2019-2020 has been developed, which guide the implementation of the agreed interventions. I pledge on behalf of the government to provide the needed stewardship and any other support to realize the aspirations in this plan. I implore you to rally behind its implementation in order to attain the ambitious targets therein. Achieving these targets means addressing critical issues that we have learned over the years of response. Although Uganda is among the forerunners in the reduction of the new infections, there remains continued transmissions of new infections attributed to a number of issues, including low comprehensive knowledge, risk sexual behavior, social culture, and economic factors. We have made significant steps on the care and treatment areas, and I thank the Ministry of Health and partners for the support in this area. Reducing new infections will require us all to commit to identifying and reaching everybody. I think this should be an area of emphasis. We should all be committed to reaching everybody. We must strengthen our health and social service delivery systems to ensure equitable access and coverage of quality, efficient, and safe services, especially to reach most at-risk populations. To accomplish the set goals, we must commit to undertake a strong and more committed national response to the epidemic and dedicate to bridge the existing gaps for effective coordination. We must also mobilize adequate resources to deliver the needed services. I'm glad to report that our own domestic resource basket for the key interventions and coordination is steadily expanding. With renewed commitment, the government of Uganda is committed to stepping up its funding for HIV/AIDS. One clean approach is that all government ministries, departments, and agencies coordinated by Uganda AIDS Commission are expected to mainstream HIV/AIDS in their work plans and allocate not less than 0.1% of the budget of for HIV interventions. So far, there is positive progress on the HIV mainstreaming strategy. For instance, in 2019-2020 alone, 38.8 billion shillings, equivalent to 10.4 million US dollars, was allocated to HIV/AIDS through the AIDS mainstreaming strategy, which goes to prevention and coordination of activities within these sectors. The government has also steadily made additional budget allocations for antiretroviral drugs. However, even when these efforts are made, there is need for HIV services to be available to all the people that may require the services. I therefore call upon the already outstanding support from our esteemed HIV development partners not to wane. I call upon the private sector to step up their current efforts in resourcing the response. The government of Uganda is committed at its highest level to end HIV and AIDS as a threat by 2030. As evidence of our political commitment, we fully embraced the target set at the global level for HIV epidemic control within the framework of the Sustainable Development Goals and rolled out the Presidential Fast Track Initiative to end HIV as a public health threat by 2030. We have also remained committed to implementing several decisions and resolutions at the United Nations level with remarkable progress. Government of Uganda is committed to sustain progress on these commitments as reflected in the third National Development Plan and by the ambitious targets set in the new HIV and AIDS strategic plan. And I also want to inform you that Cabinet has invited the Uganda AIDS Commission to come and present the HIV mainstreaming agenda as part of the sustainable management of the HIV response. And I will push this. As I conclude, I wish to reiterate my call that even as we battle the COVID-19 pandemic, we must not lose focus on ending HIV and AIDS as a public health threat by 2030. We have the evidence, the tools, and the commitment to prevent every new infections. With concerted efforts, I'm deeply convinced that we shall end HIV and AIDS as a public health by 2030. I take this opportunity to thank all our esteemed HIV development partners for the remarkable financial and technical support towards the response over the years. You've done a commendable work. I wish to thank the civil society organizations, the people living with HIV/AIDS, the private sector partners, the religious leaders, the culture institutions, and the media for keeping the candle burning. I remember when HE launched the Presidential Fast Track Initiative to ending HIV/AIDS in 2017, we laid a plan to roll it all over the country. And together with the development partners through Uganda AIDS Commission, we did it and we achieved. And that now calls and talks and indicates what Dr. Msoba said, that there is some reduction in the new infections. I want us to keep the burning. Let us not relax. Let us continue drumming on a daily basis. You've heard the Honorable Winnie Byanyima say that they would not end a speech without drumming, without talking about HIV/AIDS and how it should be stopped and how it should be really fought in the communities. I want to thank the Fountain of Honor, the President of the Republic of Uganda, His Excellency, President Yoweri Kaguta Museveni, for walking the talk. He came out openly when everybody was silent, when everybody did not want to talk about HIV/AIDS, when everybody could not even think that HIV/AIDS would be something to talk about. He came out openly and talked about it and called for behavior change. I believe in this era of COVID-19 pandemic, we should not relax to sensitize the community about HIV/AIDS. Uganda has really achieved a lot in the fight against HIV/AIDS. Let us not lose the gains that we've achieved. To my honorable colleagues at the ministries, departments, and agencies, I call upon you to support the revamping of HIV and AIDS mainstreaming agenda. And lastly, I want to wish you all fruitful deliberations. It is now my honor and privilege to declare this 13th Annual Joint AIDS Review Virtual Conference officially open.
Thank you very much, Honorable Minister. And with that, it's also my pleasure and honor to conclude my role as coordinator for the opening session, to wish fruitful deliberations, and really, Honorable Minister, just to end with a vote of thanks to all the frontline staff, the people living with HIV/AIDS, and the health workers who are working to keep us all safe. Ladies and gentlemen, you've heard of the reviews, you've heard of the achievements and the obstacles, but you've also heard a word of inspiration. Together, we can achieve behavioral change that can keep us all safe. Thank you very much and have a great couple of days.
Invite the Director General of Uganda AIDS Commission to introduce the topic of the Media Awards. As I introduced earlier, we look at the media as a key partner in our movement to the target of ending AIDS by 2030. So as we launch that campaign, I invite the Director General to give us a brief of what this is about.
Thank you. sexual and reproductive health, including gender-based violence. We've worked with UNAIDS and come up with a program where we would like this aspect of communication to be fast-tracked, and we would like to specifically focus on rewarding the media for different categories, for the reporting, whether it is the best news story, feature articles, investigative stories, inspiring community media stations, for both media houses but also individuals. And through this, Honorable Minister, we think there should be definite outcomes in relation to reduced new infections as a result of behavioral change, having passed on effective messages through the partnership and interventions. So we would like to have, we request you, Honorable Minister, to launch this award. It will take 1 year and come to the next joint AIDS review. There is a special group that will be in place to do the tracking, first of all, define the criteria and rules that will be used, do the tracking, documentation, and eventually do the awards. And we will have this as part of, our activities as we go the last mile, and we definitely think this should lead to great results. So I'd like to invite you, Honorable Minister, to make a few remarks and then launch this program. And Your Excellencies, after she's made the remarks, I will invite you to join her as she does the launch.
I would like to acknowledge that the media remains a very influential partner in facilitating and the transmission of information related to HIV prevention, care, treatment, and social support to the beneficiary population. However, previous analysis by experts has shown that media coverage of HIV/AIDS issues remain unacceptably small. That is why, starting this year, Uganda AIDS Commission, working with partners, has organized an HIV/AIDS Media Award in various categories to be given every year. The benefits of implementing the Media Awards exercise will include: 1, increased uptake of HIV services and reduction of new infections; minimize HIV-related stigma and discrimination; 3, promote gender equality and elevate women's role in society. I therefore invite all media houses and media practitioners to participate in this exercise. The details will be widely circulated by Uganda AIDS Commission. So now the ball is in your hands. I can see NTV, I can see Baba TV, and other media houses. Now the ball is in your hands. I want to see who will win the first award. And the aim is all to fight HIV/AIDS and put it to the end come 2030. I want to thank you, and I call upon Her Excellence Rosa Malango to come over and we will launch the Media Award. social distancing. I now take this opportunity and honor to launch the HIV/AIDS Media Award. I want to thank you.
Thank you, Honorable Minister. We can now be guided for